Hello everyone, welcome to sqadia.com. The topic we are going to discuss today is thyroiditis. Now, thyroiditis, as the name indicates, it is the inflammation of thyroid. Thyroid gland, it is very important structure as from the endocrine point of view, as it releases thyroid hormone in your body, and thyroid hormone is very important in terms of metabolism, as it increases the basal metabolic rate and perform various activities that are related to the metabolism, including the carbohydrate breakdown, formation of protein, and others. Now, here in this lecture, we are going to discuss about the inflammation of the thyroid gland. What happens when there is any inflammatory disease or any inflammatory condition, whether there will be the hypothyroidism or there will be the hyperthyroidism, or you can say whether there will be the oversecretion or downsecretion of the thyroid hormone. Now, obviously, when there is the inflammation, the gland is swollen, the cells of the glands are swollen, they are inflamed, and there is pain and redness, or all the symptoms associated with it. Obviously, the normal function of the gland will be disturbed. Now, inflammation can be due to various reasons. There can be any bacteria that can be associated with it. There can be any viral infection. There can be some autoimmune reason, means antibodies are attacking your thyroid gland, or there can be any other disease as well. Now, all of these things, all of these factors will obviously affect the normal structure of the thyroid gland cells, the follicular cells, or the epithelial cells, and they will either suppress the production of the hormone or they will increase the production of the hormone. As a result, the patient will suffer from hypothyroidism or hyperthyroidism and some specific symptoms that are related to the specific type of the thyroiditis. Obviously, that are related to the cause behind the thyroiditis, and from which you can also distinguish between the type of the thyroiditis, and then you can better treat your patient. So here we are going to discuss about all of the different types, and then we will discuss about the causes and pathogenesis behind them. Now, here elaborating more about the thyroiditis, there are three phases of the thyroiditis. As I told you, that either there can be the hypothyroidism or there can be hyperthyroidism. Now, let me tell you that in some situations there is both hypothyroidism and the hyperthyroidism. Basically, there are three phases of the thyroiditis. First one is the hyposecretory phase, or you can say hyposecretory phase, where there is a decrease in the secretion of the thyroid gland. And now this can be because of the suppression of the activity, and then there can be the hypersecretory stage where there is overproduction of the thyroid hormone, and then there can be a euthyroid state where there is the normal production of the thyroid hormone. All of these three stages are associated with the thyroiditis, and the patient may experience all of the three or one or two of the three phases of the thyroiditis. So we will study about them one by one in coming sections.